everyone. My name is Divya Singh, and I'm a clinical assistant professor at Howard University College of Pharmacy.
And I'm Cynthia Lee, and I'm also a clinical assistant professor.
And today we're going to be talking to you about pharmacogenomic testing and cardiovascular health in African Americans. Our body is made up of trillions of cells, and each cell normally contains 23 pairs of chromosomes. That adds up to 46 chromosomes in total. And half of these chromosomes are coming from each of our biologic parents. Each chromosome contains hundreds to thousands of genes, which is made up of DNA. Now, this adds up to more than 21,000 genes in our body, and these inherited genes make up a genetic profile that is unique to a person. So unique to me, unique to you. Your genetic profile determines everything about you. It determines your eye color, your hair color. It determines even how your brain functions.
And so I'm going to introduce the term pharmacogenomic. Pharmacogenomic is defined as a field that studies how genes affects your medications and the medication that you take. As Dr. Singh mentioned, everybody have different genes and it results in unique person. So the genes itself, it acts as instruction manual in each person's body that controls how a person looks, how they grow, how they function. And biologically, it controls how to make enzymes, which enzyme to be made. And these enzymes are used to activate or break down medications. And again, gene can be different from one person to another, and that results in different appearances, different characteristics, so that each person is unique. And biologically, it results in different form of enzyme that can activate or break down medication differently.
So your pharmacogenomic profile is really what determines how your body actually responds to medications. Some medications may work better while some may not work for you at all. Some genes can actually affect how likely you are to experience a side effect from a medication. And if your doctor knows your genetic profile, then they're able to determine if a specific medication is a good match for you. Now, like I said, there's really been a paradigm shift because a little while ago, we were really doing the traditional approach in all patients in all settings, where every single person got the same dose of the same medication, regardless of their genotype. But that has really shifted now because of the information that we have learned about pharmacogenomics. So now, because we have more information, if we have that information about your genotype or specific genes that may be relevant for a specific medication, that helps us actually determine if that medication is the right medication for you.
All right, so for the purpose of this presentation, we are using one example of medication, which is called clopidogrel, to sort of provide examples on how pharmacogenomic testing can benefit medical treatment. There are a lot of other medications that might be affected by different genes, different form of enzymes, but for this purpose of this presentation, we'll focus on clopidogrel. So clopidogrel is an antiplatelet agent. It is very commonly used in patients who has coronary heart disease, especially when somebody has encountered heart attack. It's used to prevent blood clots from forming in patients who might have had a heart attack or who might have gotten stent placed in their coronary arteries. And this medication specifically needs to be activated by an enzyme that's called CYP2C19. And that's how it gets activated and work its way to be effective in an individual. If there is a reduced activation of the enzyme, it can cause reduced activation of the clopidogrel in the body, and that can increase risk for another heart attacks, for another cardiovascular events, or even death sometimes. So the gene that affect clopidogrel, the CYP2C19, as I mentioned earlier, different patients may have different forms of the CYP2C19. And this is a concern because not everybody will activate the clopidogrel normally the different forms of the enzymes are categorized into 4 types. So one is those who are ultra rapid metabolizer. Another one is those who are extensive metabolizer, and those who are intermediate metabolizer, or if they are a poor metabolizer. The ultra rapid metabolizer and the extensive metabolizer, they do have normal activity, or sometimes the ultra rapid metabolizer will have increased activity. And in results of those activities, they do have normal response to the drug. The concern came up when we detect patients who are intermediate and poor metabolizer, because they do have low activity of the enzymes. And in result of that, then the patients have reduced response of the drug, and they're at increased risk for another heart attacks, another cardiovascular complications, or even death. So that's where pharmacogenomic testing come into place. Pharmacogenomic testing can identify patients based on their CYP2C19 forms. So it can tell you if you're a ultra rapid metabolizer, or extensive metabolizer, or if you're intermediate or poor metabolizer. And pharmacogenomic testing, other than trying to get a sense of how you respond to drug, it can provide information on how, if the drugs are information on how effective the body responds to the medication, how risky you are on getting adverse events. So there are a lot of benefit in getting pharmacogenomic testing in that sense. And again, specifically for CYP2C19, it can classify individuals to the different types of the CYP2C19 forms. And once the genetic testing results are in, it can be used by medical providers. It helps us, your physician, your pharmacist, to determine the optimal medication regimens. So for example, for CYP219, if you're poor or intermediate metabolizer, when you have lower activities, lower response to clopidogrel, then you are at higher risk for another heart attack, for another cardiovascular complication. So it can prompt us to optimize your medications by switching you to a more effective medication instead of keeping you on the clopidogrel, which you might not be responding as effectively as you could have with another medication. And the way we detect this, the poor and intermediate metabolizer, is by doing pharmacogenomic testing. And since CYP2C19 is an enzyme, it's literally extrapolated from a gene, we can test individuals who are on, taking clopidogrel, and maybe they're at a high risk for getting cardiovascular complications. We want to identify those individuals and test them for this enzymes, and to see what type of form of enzyme they have.
So now I want to talk a little bit about the CPIC guidelines. So if a person has a heart attack, and let's say that they're in a situation where they're put on clopidogrel, then what we're able to do is specific genotyping. So we're not going to be genotyping all of your genes. We're only going to be assessing the CYP2C19 gene. And once we assess this gene, we will get a result that tells us what your specific genotype is. And based on that result, we can put you in a category of either being an ultra rapid metabolizer, being an extensive metabolizer, being an intermediate metabolizer, or being a poor metabolizer. We have data that shows us, and information that recommends, and as per the guidelines, if you are someone that is found to be a ultra rapid metabolizer or an extensive metabolizer, this is a situation where the clopidogrel is going to be working as intended based on your genotype. So we are not going to have to really make any changes, where we can continue clopidogrel at the dose that you're currently receiving. However, if you are found to be an intermediate metabolizer or found to be a poor metabolizer, this is, as Dr. Lee explained, a situation where the clopidogrel is not working as intended. If you are found to be an intermediate metabolizer or a poor metabolizer, we would then recommend changing that specific medication, the clopidogrel, to an alternative antiplatelet. And we do have two options that we can switch to. one of which is prasugrel, and another one is ticagrelor. So there are various ways that we can do specific CYP2C19 pharmacogenomic testing. And again, I want to emphasize the fact that a lot of these tests, we can specifically look just at CYP2C19. So we can do this through a blood test where we get a blood sample. This is very commonly done in the inpatient or the hospital setting. So in that situation, we would normally just add this specific test to the routine tests that are being conducted on a daily basis. Or we could even do a buccal swab. That is really the test that we are seeing more widely used in the outpatient or clinic setting, where it's it's very quick and it is not invasive. So patients really prefer that option. And essentially, we put a swab in the inside of your cheek, and we do it about 3 times, 3 different swabs, and then we send that over to the lab. So really not invasive at all, unlike the blood test. Then there's also a saliva test that does require quite a bit of saliva to get adequate amount of the genes required to test them. Another thing I did want to talk about is access to pharmacogenomic testing. What we're seeing is that with more education about pharmacogenomic testing and more information in the literature, in the studies about how pharmacogenomics affects specific drug selection and outcomes with specific drugs, we are seeing that really access is becoming it's becoming more widely available, and more people really have this access to pharmacogenomic testing. And if you are currently taking clopidogrel, you should ask your physician if perhaps you could benefit from pharmacogenomic testing. This is really the only way to identify if you are a poor metabolizer or an intermediate metabolizer. And if you are identified to be one, then you could potentially benefit from being switched to an alternative agent. There's essentially no other way to identify your specific genotype aside from actually conducting this pharmacogenomic testing. And it is quite quick. We have tests that can take certain buccal swab tests that take less than an hour to give us the result. And then we have tests that take a little bit longer, so it really depends. We are offering this as a service to our patients that meet the criteria of being on clopidogrel. So if you are looking to have your care managed, you can call Howard University and set up the appointment with the cardiology clinic, and the phone number is listed there for you. And we are offering this service as a free service to the patient. Thank you so much, everyone, for listening to our presentation today. And we want to thank you in advance for filling out the pre and post survey as well.